PCOS can cause infertility and increase the risk of developing other health conditions, including type 2 diabetes and heart disease. I have with me someone who, Shegun Beckley, had reached out to me a long time ago and said, you must have her. He actually called me and said, Oshodi. And I know some people that will call you, and you have to respect your young age and kindly listen to them. I have with me a social impact entrepreneur, women's health and PCOS advocate, and the founder of Bloom Woman Initiative, a non-profit initiative advancing women's health through education, fertility support, mental health, nutrition, and community outreach. Since the launch, BWI, that is the Bloom Woman Initiative, has reached over 2,000 women and supported successful pregnancies, creating hope for women and young girls in underserved communities. She's also the founder of Tersly Foods, a regenerative agro-processing company promoting food security, family nutrition, and reproductive wellness through safe, health, and accessible foods. Passionate about empowering women and youth, she uses fostering equity to consult for purpose-driven organization and helping them enhance productivity, team efficiency, and value-driven impact. Welcome to Signals on 91.3 Lagos Talk, Sarah Afolabi Olagoke. Finally, you have me where you want me. You do have me where you want me.
Good morning.
Good morning. And yes, we're discussing PCOS awareness. The English I was looking for, it left me and it has to come back. Now, with PCOS, what is it about PCOS? I've had different women and my heart yearns for them constantly when we have these conversations. I met with a lady over the weekend and she was like, oh, she has PCOS. And I'm like, Sarah is going to answer a lot of questions because I'm not about to get into these waters. But yes, we are into these waters, and it's PCOS Awareness Month. What is it about PCOS? Enlighten us.
Okay.
Good.
Good morning, Lagos. Good morning. Okay, so PCOS, I know when people hear about PCOS, first thing that comes to their mind is, oh, reproductive disorder. Actually, it's beyond that. PCOS is a full body condition that, like you said earlier when we were introducing the topic this morning, that it's hormonal imbalance, and one of the symptoms, in fact, the most common symptoms in women is irregular periods. And some people, they may not see their periods for years, while some would be having excess bleeding. So if they are not well diagnosed, they will be treating something else.
You will be treating pregnancy and thinking that it's not pregnancy.
Exactly. In some, and it varies in every woman. And trust me, PCOS does not know race, location, or age. It does not even wait until when you get to adult stage. No, it starts once you hit that reproductive age,
So,
because it deals with blocking the ovaries.
okay, God needs to answer some questions.
So aside that it blocks the ovaries, and if it's blocked, how will ovulation take place? Talk more of periods. Even if you see bleeding, if there's no ovulation, there cannot be conception, except in miracle cases.
Let's leave that miracle first. Let's talk about science a bit. And why is it so common today? Because the awareness for it is now much more than I didn't know about PCOS when I was in secondary school. We just knew that there is so many myths about if a woman is bleeding for 7 days until she gets married, and I hated it. I still hate it, right? And some will bleed for 2 weeks, and they say, okay, don't worry, by the time she gets married or gets pregnant, it will stop. And led to a lot of teenage pregnancies very early because people were not aware.
Especially painful periods.
Painful periods, and the moment you have stained, and then another myth is, oh, by the time you get your first period, they will kill chicken for you. Yeah, they will not kill chicken.
My first period was actually in class.
Yeah, and then there was this thing where the moment a young girl has a period, it's almost like a shameful thing. Right. So enlighten us on, because
okay. So
one thing starting about periods at 9 years old. Let's help.
One thing is that we need to understand painful period is not normal.
Okay.
It is never normal. And thank God for endometriosis advocates who are now speaking up,
Okay.
because it's so much, so much. Then for PCOS, what it does is, once the hormones are not balanced, and when we say hormones are not balanced, it means that as a woman, on your ovaries there are presence of the androgens, that's male cells. So that's where you will see some women starting to have hairs in unwanted areas, except the head. They will not have hair. Yeah, but you see the chin, the body, everywhere, the voice, like you will see that they begin to change.
Like to a man.
Yes, and the questions will be like, what is going on? And because it was not that common then, so some people will say they dismiss them, or some are not even diagnosed.
Okay.
Yes, and they will just tell you, oh, you need to lose weight, especially for those who are trying to conceive. I know how many times I heard, oh, you're too fat. Even when I just breathe, the air, free air that God gave me, I'm going to add kgs. So I'm like, okay, maybe I should just stop breathing and taking water and see if I would. And it's so funny that if you're trying to lose weight as a PCOS woman, it's very difficult, because one, you'll be so under pressure, you'll be so pressured that you want to lose weight. And I tell women with it that please don't even go to the gym and start doing the wrong programs. Yes, you don't need that excessive stress, so you won't burn out and go and faint again. So you just need mild exercise, and it's so easy. And by that time, you will see that gradually there are going to be changes. But beyond losing weight, there are so many other things that you need to do naturally, and also medical support. That's supplements, and that's where our doctors
are coming in.
will now come in.
Now, is POS genetic, lifestyle driven, or a mix of both?
I would say it's a mix of both, because you said something earlier that why is it now rampant? Why is it now common now? It's because then people don't actually know what was going on. And I say it every time that the lifestyle we're living now is totally different. I am in my early 30s. The life I'm living, what I'm experiencing in Nigeria, in Lagos, in Africa, in the world, as a 30-year-old lady, my mom did not go through 1% of it while she was 30 years. So if she does not have it, if they are generation, if they don't have it, it's understanding. The food we are eating now, even the cream we are using, you will hear, oh, don't use relaxer today, oh, use relaxer tomorrow, is good, don't use this, don't take this, oh, take milk, don't take milk again, take fish, don't take fish again. Then you'll be like, okay,
what are we going to do?
And even our little angels are not even spared.
No, they're not.
They are not. I know how many times I bought fake products, that's formula for my son.
Wow.
A child that everybody that knows me prayed and fasted and supported, all the doctors, everybody from Nigeria to South Africa to Ghana, everybody for 7 years. Then imagine her feeding him
with fake.
So you can imagine, even our sanitary pads.
Yeah, I was going to speak on that. I think over the week we got sanitary towels, and even the sanitary towels are not as quality as it used to be. And then you are torn between tampons. For some people some of us don't like to use tampons. And then you're wondering, do you go back to clothes that, even though they say well, we are now in recycling.
We are back to it.
We are back to recycling.
Is it reshaped, remodeled, rebranded? And then
it's almost as if they're out for women, right? Because sanitary towels are no longer is expensive, but has reduced in quality,
and
right? Safety. So how then do we balance? All of this? I'm not even worried about us. I'm worried about teenagers that are coming up, right? I'm worried about. We say we'll wing it. We'll keep winging it. But for them, how then do they see? If I off your concentrate,
I am with you.
If we look at how then do we pass proper information to the ones coming? Because we're having 9-year-olds, 10, 12 people starting their periods, and then I'm like, how many blood will remain?
Okay, so this is it. For how do we survive it?
Yeah.
That's where we need our regulatory bodies to come in, because
Our regulatory bodies know what they are.
it's just something else, because the I think a few months ago there was an outcry on this same sanitary towels, and the scientists, they have came up with another research that okay, the chemicals in it is heavy, and it's not only PCOS, it is not only hormones that is now messed up, cancers. Now I have a like you said, I have an
Initiative, the Bloom,
linked with my profit business, that's Tersly Food. A friend of the initiative reached out. He's a medical practitioner and he has a health foundation. Just called me one day. That day I was also reading stories about cervical cancer, and I was like, what are we going to do? Then he just reached out and said, Bloom woman, the rate at which we are recording cervical cancer cases at my hospital is alarming. For a place like Likosi, what can we do? I said, we are going to do screening. I said, how do we source for fund? I said, I don't know, but same thing you are going through is what is happening right now with me. We are going to reach out to, even if it's just 100 people, 100 women that we can liberate. Let's do this. And luckily we were able to screen more than 250 women. And I'm telling you that the percentage we had that were tested positive. Then I was seated, yes, I was seated somewhere. They were expecting me to come, and someone that should come and comfort them. Me that was already crying, you want me to comfort? How do I do
now,
it?
What do you think is going on if we have, as of 250 women, a larger percentage of them already have cervical cancer?
Let me shock you.
Please do.
We have teenagers among them. You know, cervical cancer is mostly for sexually active women already. But now we are in an age where we cannot hide from speaking
about
talking about sex.
Yeah, because there's something that trended where we have some young students who had family planning in their hand, and for me that was alarming.
And some parents came out and said they support it.
Well, because I saw the picture of the
implants. Yeah. We now we are like, okay, we are not women already. Older women, they are like they are okay now. Instead of focusing on them, let's just go back
to secondary schools,
to secondary school. So that's what we have, an initiative coming up, an outreach rather coming up with Bloom Woman in Ogun State, Ofada, by 30th of this month, for us to celebrate the PCOS awareness and also link it to cervical cancer, and also the International Girl Child Day, which is in October. So we are like, okay, what we are going there to talk about, we are going there to speak raw to these kids, because we already know that you people know more than us. Yes, so now we want to come and talk to you people, our orgasm. That's it. So because if we don't start educating the young ones, the teenagers now, by the time they will get to their 30s and I don't know what would happen. So we need to start educating them, giving them the knowledge they need to know about, so that from menstrual hygiene to being cautious of their reproductive health and their general well-being. Yes, everything that they need. Because some of them just know that they don't even know the
side effects of the
effects that comes with these things. You see some online taking some things for maybe trend or so, but you don't even know
your body.
I met a woman. We have a woman in our community, because Bloom Woman, we also have a support. Because
I was going to ask you about the 2,000 women, but go ahead.
So we have one woman, and she said that day when she was speaking with one of our consultants, and she was like, I was there on the call, so she said, I have never tasted alcohol. I never had abortion. I never did this. I never do that. In fact, I married as a virgin. So now, how come I am having endometriosis and PCOS
At the same time.
at the same time?
Okay. That's it. Signals on 91.3. We're discussing the PCOS Awareness Month. And if you have questions, comments, call us or send us a WhatsApp message 0809 234 5913. Or you can call the phone line 0704 700 8913. We still have Sarah Afolabi Olagoke. Now, with PCOS, I'm trying to look at PCOS with women who are trying to conceive and haven't experienced that. You want to share what we because sometimes is it the food that we are eating, is it the water that we are drinking? Before we call down the heavens, let's talk about the science that is. How then do we? I'm asking you a lot of questions.
Yes, no problem.
And how then do we begin to at least know our bodies? At what point do we need to get to the hospital and say, doctor, help?
Okay, so one thing I tell women is that once you see that you are experiencing some changes, and one common symptoms about PCOS is some people start with irregular periods, while some start with unexplainable weight gain, and some actually lose weight as well. So once you start seeing these changes, maybe you've
So
not
if you say
misread it.
irregular periods, pause. What is regular? What is
It's not
irregular?
regular. Okay, so your cycle is meant to be between, I think, 27, 28, and then you are now seeing it lesser than that or after that, or you menstruate this month and the period is not coming next month, and like that it's shaky, and sometimes it will just come like a drop, boom. Then you'll be like, okay, maybe it was a mistake. It will come and it's not coming. On the 3rd month, please just go to the hospital.
Okay.
And if you're experiencing excess bleeding, that's you are using more than 8 pads in less than 10 hours, please, what she is what you faint on the road, Lagos road. People don't buy people milk again. Hey, please, straight go to the hospital. If you're going to meet a doctor, make sure that there are people in that field, women's health, physicians, gynecologists.
Okay.
Yes, please meet them. I understand that consultation fees and the rest is really high now.
Try enter the hospital first and go and apply for help.
Enter. At least your life is, because if it's not treated, it leads to type 2 diabetes because of the insulin resistance. That's a situation whereby the metabolism is not doing well, the cells are not responsive, you are eating is not distributing to where it's meant to distribute to, so it's storing excess fat and excess sugar, you are not burning energy, so you get, it leads to that. It's, in fact, recently now we found out that also it leads to high blood pressure, and that's why you hear that some young adults are now hypertensive. Aside the regular stress, it is so much. You see a lady of less than 30 years old on BP drugs, so it leads to even cancer.
Okay. Is this PCOS only for women?
Funny enough, even the men's health, I am not happy that we are not really having people that speak up for men, because they're going through a lot, and because I have been in TTC situation before, now I'm relating it to the women who are trying to conceive. When we were trying to conceive, my husband had to go through several tests.
Husband, sorry, but let's talk.
You get, so several tests as well, and it came out fine, and it was like, I was like, why did you even
go through it?
He said, you people, you're lucky, you women, it will show immediately. Unlike men, the only thing I think that we are loud about men's health is the post-release cancer, and by then it would have been worse before they even know. So there are other illness there too. So PCOS, now men don't have ovaries.
I was joking, but I just needed to enter that. Now, having gone through, is it okay for us to have ask
Yes,
conversations
yes.
about trying to conceive? Now,
Yes.
for how long did you go through trying to conceive? At least I have Nathan, so I can ask this question.
For 7 years
7,
and 8 miscarriages,
8 miscarriages.
3 failed IVFs,
Okay.
2 failed IUI, that's artificial
Elimination.
insemination. And then I had to go through this test, HSG. Some people said they did not experience pain. Please, my own pain level is very low. So for all TTC women, moms, just
I like the fact that you call them moms.
see, hang in there. Hang in there.
3 failed IVFs.
Yes.
8 miscarriages.
It's got to a point that whenever I tested positive for pregnancy, I don't even jubilate. The next thing I will be counting is this when I'm going to see the blood again. That was it. So it was like that. And then because PCOS affects every part of your body, it affects the mental health, the physical, and the psychological aspect. In fact, financially, it's because there are some supplements at that time that I'm really happy that we are now loud about it.
Yes.
Because we are now having some supplements that were not even available before, or they are very expensive. We are now having them now that you can use. We are having natural remedies as well. We are having more medical practitioners coming up. Lifestyle changes. We're having lifestyle coaches coming out now to help women go through these things and survive. So it's a whole lot, but with time and the right management, and that's why we say that early detection aids effective management for a better life.
Say that again.
Early detection aids effective management for healthier life. For an healthier life. See, because once you know, when we know immediately, it's okay.
So at what age do you think is required? You've talked about irregular period, excessive bleeding, but at what age is required to say, okay, it's time for you as a woman to go to the hospital to start to find out?
Please don't wait till when you're ready to conceive or when you're planning marriage. As long as you are at that stage, that age of reproductive, and when I mean reproductive,
the moment you start your
periods, once you see your periods and then you notice any changes, please go to the hospital. In fact, some doctors will tell you that when you notice that the blood color
has changed,
don't wait. In fact, let me shock you.
Shock me.
Do you know that
Shock me.
some women that are not pregnant, they are not breastfeeding, they lactate? That is hormonal imbalance.
Please, I just have come as a man now. What I take what you care now.
So just
because it's a lot of work. I was having a conversation with someone and we're talking about periods, and she was asking me questions, and because me, I'm always laughing, and they always want me that you'll be going through a lot, you'll be laughing. Now and we're talking periods. I said okay, so sometimes I'll be vomiting. I'm like, okay, so if we start to vomit, let's say, are you praying? I say, pray, how? Where is it coming from? And because the intricacies of periods are very, very dynamic, because you really never can tell. Some days you want to eat ice cream, lick ice cream. Other days you want to eat beans. Other days you want to eat rice and beans. And then you're wondering, when would it stop? And for some of us, we used to look forward to menopause, but then menopause is another conversation entirely. We haven't reached menopause. We are still menooing, and this is a lot of pain. And then I'm worried for teenagers, young adults who have access. They don't even have access to sanitary towels, not to the right sanitary towels, because it's not every sanitary towel that is safe, right? And yes, some of them, most of this, well, let's say 50% of them are beginning to have sex very early. How then do we begin to educate the men having sex with women and to be following them up and down, say, okay, please. Because let's talk about pills. Recently, I think a Aproko doctor was talking about a fake Posinon too.
Yeah.
And imagine how many
That came out
to also complain about it. So imagine how many you go to the pharmacy, take Posinon too. Let's not even talk about those post pills.
Children that come from that kind of situation. You say, "Oh, shock me back on."
It did not need to shock you anyhow. How? Sarah. It's not even shocking you anyhow. You have shocked me 3 times. Now, how then are we able to really give them the knowledge? Because some of them, like you said, they know more than us, but they really don't know more than us. It's just, again, the right knowledge. How then are we able to really educate them properly? Because the man will have sex and do like this and go. You are left with the... If you not see your period...
Do you know that cervical cancer? A research, not some research, they are still working on it, but some are saying that it is actually from
Sperm.
the men.
Okay.
So abstinence
You see,
for teenagers.
it's very
We
important.
will still go back to that abstinence for teenagers. You don't have business with sex.
As
When
a
you
teenager,
need to,
as a
yes,
young adult, you
as a
don't have.
you don't have any business with it. Let's leave religion, let's leave morals out of it now. Because see, I tell people that for early sex, except situations of rape and the rest, the one that it is
You open your
peer
eye like
pressure,
this.
you open your eye,
Peer pressure. We talked about peer
peer,
pressure.
peer pressure that leads you
Okay.
to it. See, the best consequence that comes with it, me, I see it as the teenage pregnancy, because beyond pregnancy, pregnancy will show. It will just if the girl is lucky to have families that they will say, okay,
Support.
go back, support and the rest. That's it. What about life-threatening conditions that comes with having sex at early stage?
Yeah, but you know, some people say our mothers,
And our mothers did, or people in
they have gone.
or that
Whether-
they do it early.
You see, whether they do it early or they do it late, I think pregnancy changes a lot of things.
A lot. It comes with everything. See, and this our body. That's why women, I tell people
Our wala
that
is too much first.
aside our wala, we carry. God really took time
Oh Lord.
to create us.
But God did not. When He took time to create us, He should have left out all those issues.
But no, look at what gold goes through before it comes to
No,
gold now.
that's not enough. That please. Gold is expensive. That's but really.
That's it.
No. Don't. God has a lot of questions to answer. It signals on 91 point. Sarah. Because it's a lot. Have you seen? I admire trying to conceive women, moms, right? Trying to conceive moms. I admire women who are going through painful periods. I admire people who have to, because they told them that don't worry, by the time you get pregnant, the periods will stop.
Some will even say when you start having sex, and that was what led to a lot of teenage pregnancies while growing up.
So how was the support like while you were going through those years of? At least you have me Nata. Give me Nata.
Okay, so I thank God for support. At least you're one of the people.
Well,
now.
please, don't. I'm the one interviewing, so let's ask questions, because we've had people who there's a fibroid.
Yes. In fact, some people have
Fibroid,
PCOS
fibroid.
and fibroid. But trust me, you can get pregnant with PCOS.
Okay, that's
it.
That's good.
And it still boils down to early diagnosis
Helps.
effective management. Because you are able to detect it and you get the right management. It's really
So how do we then get the right management if someone detects very early that they have PCOS? What should they do? What should they do really?
So that was why I said PCOS is beyond reproductive, that's getting pregnant, or fertility, because it comes with it affects every other thing. So for what should they do? aside trying to conceive or doing everything for fertility purpose because you want to ovulate, you want to have a healthy pregnancy, you want to carry your bundle of joy, there are other things that you need to do. You have to first be committed that okay, I want to do this. So you need to shake body, that's exercise. Even if you have to just lift something, you need it. You need to, in fact, there are simple exercises.
Simple
like
exercises.
Walking, yes. I beg, don't go to gym and go and carry big, all those heavy dumbbells. Just walk. You can do mild one at the gym or do your morning walks and evening walks 1 hour per day for maybe 4 times in a week.
With 5,000.
Then changing your diet.
5,000 steps.
Then changing your diet as well. You need to consume more vegetables, fruits, all meals. Yes, fibers. Why we recommend fibers is that it helps you to curb eating disorder.
So if you say fiber, which food is fiber?
Okay, the likes of oats. You see oats meals, they should change that name to Bobonishe.
Really?
Yes. You want to lose weight? You want to add healthy weight?
Oats.
You want to lactate?
Oats were expensive.
As a new mom?
In the market now. Oats, okay. Oats
you want
first.
to lactate as a new mom? You get, it does a whole lot of magic for you. You need to get also change from processed food. There are some foods that are overly processed out there. So I tell people you can always replace all-purpose flour because of the gluten content in it and is over processed. You can replace it with the likes of oats flour, rice flour, beans flour, sorghum unripe. You sweeten it with date syrup or powder, honey.
You know, recently, let me even confess. Recently, I found out that my blood sugar was like 157 or so. They now said I should go and do cinnamon. I was not taking the cinnamon. I was taking it, but then I decided to add it to food.
But cinnamon does wonders of magic. Okay, so if you add it to zobo, it's a game changer. You know, I'm also a spice. Spice processor. Trust me, our spices, don't joke with them.
Our Nigerian made.
Most spices you get them here. Although we have to import some, but even the ones we import, we still have them here. It's just because we food insecurity.
Okay.
And don't let us go deep into agriculture today. Let's flow with the women.
Okay.
Yes.
But so, women will eat now, so you have to talk about.
Yeah. So due to food to shortage as well, so that's why they have to bring in some spices. But our soil is good, and we have amazing spices. You see ginger, cloves, cinnamon, star anise. There is this one. In fact, you see that zobo, hibiscus. You know it's Oyinbo people that call it hibiscus leaf or tea. Please don't joke with it. But everything with moderation.
But they say that when you are pregnant, you shouldn't take zobo.
Don't go through it because of the particles, the properties present in hibiscus leaf itself, and the other spices that you include.
Okay.
So
when you are pregnant, don't take zobo.
Don't take zobo.
Okay, but when you are not pregnant, you can.
Yes,
take
except you want to induce labor. Yes, if you want to induce labor, then you can now take zobo.
Don't go and induce any labor.
But don't induce you. If you induce before the due date,
it will come out.
The baby will come out. He or she will help you to bring your zobo like this. The liquid. The baby will pour it on your face in the labor room. Amen. Amen. Somebody.
I know what you're doing. Well done.
You know, right?
I know what you're doing. But anyway, God, when you have women so now,
yes, it does.
Nobody should go and take zobo when you're pregnant.
And this lady came out now. Diary of
an angel
kitchen lover. She even landed in the hospital.
Don't take zobo while pregnant. Men, as you are listening,
please don't.
Don't allow them to take zobo.
Or for people with high blood pressure, it's actually very good.
They say unsweetened zobo.
Unsweetened zobo, yes. Don't look at me that way. Sweeten it with dates, please. Don't leave sugar alone.
Okay, so we should leave sugar alone.
White sugar alone.
And take dates.
Yes.
Okay, so it means that with proper feeding, we can reduce the risk of PCOS.
Yes, and lifestyle.
Okay.
You need quality sleep.
Quality. How many?
I have joined a local doctor now. You know he's always shouting about water. Me, I will be shouting sleep, quality sleep, rest. Please don't ever feel guilty
of sleeping.
Yes, for sleeping or for resting.
Okay.
Don't.
But you know, professional speakers tell us that if you are not sleeping.
Okay, if the body now breaks down, what will now happen? So the money that you want to go and collect from lion's mouths.
So we should sleep.
Yes, you need quality sleep, and you know the recommended hours is 8 hours.
10 hours.
Yes, but you know now, with this age, even if you can get 7 hours, 6 hours, it's still something.
Okay.
Relax, find a way to relax. If you know that it's when you go out,
Okay.
when you meditate, or when you hang out with friends, or they also say that if you love someone, if you are in love with the right person and the person too loves you back, that if you are in their arms, that is a form of relaxation too.
Cuddling. So that's
please.
cuddling. They should cuddle in the right. See,
I did not say anything.
see, women. When I say women have wahala, you have taken me out of my zone, so I have to.
But did I say anything?
No, you didn't say anything. Now, it signals on 91.3. We're discussing PCOS awareness, how we can stay healthy while treating this unwelcomed disease, because it's a disease, really. If you have questions, comments, call us 0809. Send us a WhatsApp message 0809 234 5913, or you can call 0704 100 7913. Now, are birth controls pills the only effective treatment option for symptom management?
Okay, the reason why consultants actually they usually recommend.
Some say it corrects.
Yes, because the first thing they will, the first investigation a consultant would want to do would want to carry out on an assumed or possible PCOS condition is that they would want to first try to regulate the period.
Okay.
So that's why they usually recommend it. Although advocates are not saying no, don't give us
pills.
I had my own fair share of
Post
effects. Yes, in fact, my uterus was affected. That I slumped. So you get, and I had to do minor procedure like that. So, but the reason why they usually recommend it is just to regulate the periods, to first see that okay, maybe it can
regulate itself.
It can regulate itself, but then it is not the best option. It is not. So just carry out the necessary tests that you need to do, from profiling, progesterone, to tracking, to TVS. That one is even the easiest. It's very simple, and because although that one will show you the womb, the ovaries and the rest, so you will see if there is cyst. And trust me, not every PCOS woman has cysts.
Okay.
Yes, not every. So, and that's why I said PCOS varies in every woman. It varies.
Yeah,
It varies. You see, and even that's why I said we are doing Catch Them Young with this
now.
outreach.
So with the initiative coming up, when is it coming up?
Okay, it's coming up on the 30th of September.
In Afolabi?
Yes, it's a Tuesday.
Okay. Now, what should the girls look forward to?
Okay, so they should look forward to learning from professionals, because I am just an advocate.
Thank you for advocating, because this is a lot of work.
I'm
tired already. It's a lot of work. Well, go ahead.
Thank you so much. So we are coming with our medical partners.
Okay.
So they are going to be there to talk to them, answer all their questions, because we are going to have like an hour counseling, 1 to 2 hours counseling with them. For those who have questions, they are going to also learn about menstrual health education. We are going to talk everything about being a woman. Everything they are going to be equipped with everything else necessarily for them to transit into womanhood smoothly.
Okay, that's
Then we are going to be gifting them as well sanitary towels, and other wellness gifts, and like wellness pack, a full wellness pack that you're going to have some other things, and also card. You're going to get an affirmation card and eating like a meal plan cards. Yes, so they can show their parents at home.
Okay.
Yes.
For older people who are listening, guardians, uncles, aunties, older women, older fathers, and what should they begin to? What is really needed of them? For people who are around it, for women, for girls, for daughters.
Nigeria uncles and aunties.
Again, it's not me.
That girl that has gained weight suddenly, it is not because she likes Ijakuja. It's not because she's eating she's eating too much, or because she's a glutton, like they used to say, glutton, yeah. No, it's not that.
You will know she's a core Nigerian. Go ahead.
Please, you need to first do your research. We need to know the roots, which is finding out what happened. If you ask us questions, now I'm talking for as a younger generation, I'm talking as a Gen Z, as an alpha. Please, what's that other thing? That other thing now. I'm not talking as a
millennial.
I'm not talking like you people. I'm back to
baby
Gen
boomers.
So I am talking for every one of them now. There are ways you ask us questions that will be able to give you answers.
So ask the right questions.
Ask the right questions so that we can open up to you. Don't just come with, oh, it's because you're having sex now, that's why you're having pimples. Oh, it's because you did not see your period because you have gone to use post pill. Ask the right question. Oh, I noticed these changes in you. Is it right time for me to ask you this? Is there anything you need? Because this is what I was able to get that support from people around me. But there are some, even women, married women, they don't have that support. In fact, that was why we started the support group of Bloom Women, because a lot of women have been stigmatized. Oh, she's a witch, and that is why, or she has done so many things as a single lady, that's why she does not have womb again. No, please research. I was lucky because my mom-in-law, she's a retired matron.
Okay, that's nice.
So she understands. So, and my husband too works with UNICEF at some point, so he understands a bit. So you get, but there's some, my mom, she did not understand at first still. She's a teacher with a command. She did not understand. She started with, where you will not eat, because I don't eat well. So why will you have period now? You don't have blood because you don't eat well.
That's a typical Nigerian mother.
You get, so like that. It took my mother-in-law to
explain to every trying to conceive mom. You are amazing.
We see you.
We see
you are valid. We understand your struggles.
It's coming from someone.
Real.
Yes.
If we could have a TTC mom of 21 years, and she gave us our Bloom babies, twins, like very cute baby. In fact, I felt like carrying one home that day.
Nathan is enough for you. Now to trying to conceive moms, you are doing well. To every woman who's going through one PCOS, endometritis, God, all those regular periods, the times where your period will not come and you think that, and to every woman who has gone through pills and painful pills, you are worthy. For every woman who's gone through a fibroid surgery and it's not convenient and it's looking like the child will not come, and for every woman who is trying IVF and it's not looking at, and it's okay, science, God is still science. God, it's okay because there's still this subtle stigma where they're saying, oh, it's IVF babies, and they're babies, they're human beings. And I'm wondering,
IVF baby is even better. What about CS? And
I don't even know where.
How did we even get here as a society?
Let me just be nice with words right now. To every baby, to every child, to every woman, to every family, please, we need your support. Support them, don't abuse them. If any person is fat, leave them. It's not your fat. Their fat is not fat to you. Right? Well done to every woman, to every supportive man, to every supportive family. We see you, we love you, and we're saying thank you. Until we come your way again next week Saturday, like we always see on Signals, dream again, create opportunities for people. Again, people used to be people. Have a wonderful week, and God